All right, welcome everybody. Happy Tuesday. I think we are up and running now. So happy Tuesday, everyone. Happy November 12th. Thank you for joining us today. We are going to go ahead and get started since it is 12 o'clock and we'll let people in. Up, looks like we have a good group already. I am Andrea Young, educator and communications lead. And today we are joined again by Beverly Roberts to help celebrate Family Engagement Month. And today we are going to be going over North Carolina resources for children and youth with disabilities. So here you go, Beverly.
Okay, I guess I'm on. Good afternoon, everybody. Thank you so much for joining us today. We're going to start out letting our interpreters share the process in case we have any families that need interpretation. So I'm going to turn it over to you all. Philippa, can you all hear us? I don't know what happened. Maybe somehow they got disconnected. Andrea, what I think I'll do is I will just continue on, and when they come on back on, we will stop and let them explain. So once again, welcome to today's session, and this session is about resources available to families of children with disabilities. And as you already know, navigating the world of services and programs and supports can be so overwhelming. And one of the key pieces of this is understanding what is available out here for your families that can help improve the quality of our family lives. So in this session, we're going to share some resources specific to educational resources, financial assistance, healthcare services, advocacy, and community supports. The goal is to provide you information that you can access and help you find resources. One thing to know up front is all of you that are participating today will receive a copy of this PowerPoint. I'm going to try to get that out to you today because we have so many resources and we only have a little bit of time. That it's going to be important for you to have the slides so that you can have the contact information, you can have the questions, and that at your own leisure, you can take another look at this.
I'm so sorry to interrupt, Beverly. My microphone was muted and I couldn't give the announcement, but I will briefly give it if that's okay with you.
Yes.
Hola, muy buenas tardes a todos. He puesto las instrucciones en el chat de cómo conectarse al servicio de interpretación. Por favor, si están en su computadora van a ver un mundito o si están en su teléfono, asegúrense de usar la aplicación de Zoom para que puedan usar el servicio. Recuerden, nosotros vamos a estar monitoreando el chat si tienen alguna duda o dificultad. Todo lo que se diga en inglés será traducido en español. Thank you so much, and I thank you for your commitment with language justice. The instructions are also in the chat, and I'll be posting them if we have people that log in a little bit later so they can follow the instructions as well. Thank you so much. I hope you have a great meeting.
Thank you so much. As Andrea said, November is Family Engagement Month. I have to say that at least 5 times a day. I think this is my 4th time already, but it is such an exciting time. And I just want to remind you to please take a look at the Family Engagement Month webpage with all the activity calendars. Since the last time we had Two-Time Tuesday last week, we got the governor's proclamation, hooray. So it's officially proclaimed Family Engagement Month. When you go on the website, if you would take a look at that proclamation, and we would appreciate if you would sign on to that proclamation with support. So please take a look at the webpage, take a look at the activity calendars, Two-Time Tuesday sessions. Next week, we will be talking about self-care, so please don't miss that. One of the things I do want to mention from last week, we talked about, one of the things that we talked about was creating a family engagement plan. And one of the things on that family engagement plan, in addition to a communication plan, planning for the next transition, because we always need to be looking for that next transition and planning for it. We talked about planning for the IEP meetings, setting goals for family activities, regular family check-ins, but we also talked about the importance of identifying information and resources that you need. So this is a follow-up to that, to share some of those resources with you. Okay, what do we hope here in terms of who we're talking to? We hope that these resources will support families who can directly benefit. For those of you who are family leaders who are out there sharing information, we hope this is helpful. For any professional who is looking for additional resources to share with families, but know that this is not all inclusive. There is so much more out here. And so that is why it is important to share these resources. We don't have every resource on here. We will be updating these resources, but we really wanted to give you a good sampling of the potential resources. So let me tell you how I sort of worked this presentation. Because we have more resources than we have time to share. As I mentioned, I've separated the categories out into 4. One being educational resources, the other financial assistance, the other healthcare service, and the other is advocacy and community supports. What I also want you to know is this is very fluid because there are multiple resources and organizations that could go under any number of the categories, more than one of the categories. But I just, in this particular the way I separated it out, I only put an organization in one category. But know that as you read more on that slide about the organization, you may see that there are multiple areas that they could be a resource to you. The other thing I want you to keep in mind as we are going through this is for each category, you will see, and I will share with you sort of some key questions, some key things to think about. Because as you look at accessing resources, one of the important things to do is figure out what resources, what areas you might need more support in. So for each category, before I show you any of the resources, there are going to be key questions that you can ask yourself that can help you clarify your priorities and sort of review where you are and determine what type of resources will be beneficial. Before we get started, I just got to share this. I told folks I was going to share. As we look at Family Engagement Month, I was at UNC Charlotte this morning with pre-service teachers, our educators in training, and I'm going to tell you, there is nothing like going on a college campus and engaging with these young folk. Every time I leave inspired, you know, saying we're going to be all right. Those young folks were excited. I was sharing with them the importance of working with families, sharing with them that there are resources out here because it is absolutely critical that as we as parents are going in having these educational discussions, because remember, your schools are also a resource to you. So it was just so exciting to share with these young folk the parent perspective, the resources that are out here, and hear how excited they are to be teachers and how they are very willing and excited to learn more about parents. So I just had to share that with you. I'm a little bit pumped because it was exciting. I said, I think I need to go step on college campuses a little bit more and sap into that energy. But I want to go ahead and get started. The first category is educational resources. And these are really questions to help you see where you are, where your child is, where some of the gaps may be, where some of the needs are. One of the things that we really suggest with families is make sure you always get a copy of your child's IEP. Make sure that you always have a copy of the evaluations, because that will be the information that will be really helpful to you as you prepare for IEP meetings, as you're looking at what kind of resources you need. So here are some of the questions to think about. Think about your child's diagnosis and how does that affect your child's daily life and your daily life. Think about what are some of the specific services or therapies that your child needs. What are the services and therapies that your child have? Are there any gaps? What don't they have? What are my child's educational needs? Do I need assistance in understanding my child's IEP or 504 plan? So do I need resources to help me with that? Do I need to advocate for any specific changes, additions in my child's IEP? Are there organizations out here that can help me advocate for specific changes or additions to my child's IEP? And of course, I'm going to say yes. But just thinking about where the gaps are. Is my child making progress toward their IEP goals? Do I need to call an IEP meeting? Do I need help in maybe generating questions for that IEP meeting? And also thinking about the social emotional health of your child. What kinds of extracurricular or social activities can support my child's development? What supports does my child need to develop friendships and social skills? Just remember, don't worry about taking notes. We will send you all of this. So these are questions to help you assess where may some of the gaps be, what resources may I need. We're not going to have time to go through all the resources, but just wanted to sort of share. As you know, ECAC is a resource that can really help you in terms of assessing your IEP. But there are also other folks that can help you in terms of the educational piece. We have, for the western part of the state, there is what is called FIRST. And FIRST is a community parent resource center, much like ECAC, except for they serve the western part of the state. You also have HOPE, which is also a community parent resource center funded by the Office of Special Education Programs, U.S. Department of Education. They do very similar things at ECAC, helping families to advocate for their children around IEPs, transition to adulthood, lots of resources, but their services are for Alexander, Burke, Caldwell, Catawba, McDowell, and Lincoln counties. We also have Beginnings, which is there to help parents of children who are deaf or hard of hearing. We also, for Mecklenburg and Cabarrus counties, we have the Mental Health America of Central Carolina, that helps families of children who have emotional, behavior, or mental health concerns. And they help in terms of preparation for IEP meetings or parent meetings. In other areas, one of the things that I would look for is Parent Voice across the state, but this one serves specifically Mecklenburg and Cabarrus County. Know that as we go on, and I will sort of note that to you, there are other organizations that can help you in terms of the educational piece. I have maybe have put them in another category, but I will sort of point that out as I go on. The other piece is under education, because this is where the rubber hits the road, the transition to adulthood services. So what are some of the questions that you need to ask as you're looking for what resources do I need as my child transitions to adulthood? Thinking about how are we preparing for our child's transition into adulthood? Thinking about what is in that transition plan. My child is 14. Do I have a transition plan within that IEP? What types of services are available for my child as they transition out of school? Are you aware of resources to help you explore guardianship, alternatives to guardianship, and other legal matters? So really taking a look at your child's transition plan, asking those questions. How are we preparing? These are good questions, not just in high school, but really to think about in middle school, getting familiar with these organizations. What are some of the organizations? One of the organizations here that we knew as Vogue Rehab, that title has been changed. Division of Employment and Independence for people with disabilities. They are a good resource as to work with you and your school around transition planning, information about where to find the office in your area, work together, helping in terms of skills around finding jobs, Disability Resource Center, really helping in terms of independent living services. The ARC of North Carolina, they have information around guardianship. And so those are some of the organizations, but also know at ECAC we have Achieve. So you can look on ECA's website. They help in terms of young people developing skills to help them as they look in employment and what's happening once they transition out of school. The other piece is looking at assessing financial resources. How does my child's disability impact our finances? Do you need help navigating the cost of therapies, equipment, and other resources related to your child's care? Thinking about what the cost and what the needs are in terms of therapies and equipment. What public benefits or financial assistance can you access? Things like supplemental security income, Medicaid, the Medicaid waiver program. And do you need help applying for these programs? Who can help with these programs? Are there grants, scholarships, or other funding opportunities available for families of children with disabilities? And how can we reduce or manage medical, educational, and therapeutic expenses? So really taking a look at these questions that apply to you to help figure out, what do I need? So looking at, in terms of financial resources around scholarships, North Carolina State Education Assistance Authority around opportunity scholarship programs and the Education Student Accounts Program in terms of accessing non-public schools. Lifespan in terms of support around financial support around respite. The innovations waiver, knowing that at ECAC we have our health information center, and that slide will be in here somewhere. Christy Moore is our contact there, which can help you access where you need to go to apply, sort of help you walk through that process. First in Families. First in Families have chapters across the state to help families in terms of some of their needs. Some of their examples are helping with computers, home furnishings, respites, repair to vehicles, modifications. And from this slide, you will be able to access those regional programs. Information about supplemental security income, So those are just a few of the resources. And as I'm talking, I'm monitoring time. I don't know where the time goes. But just know, don't worry about how fast I may be going on this, because we will be sending you these resources. And you all know ECAC. We don't mind talking about it. So know that you can follow up with us and call and ask any questions. So as you look at healthcare resources, what medical professionals are currently involved in your child's care? So what do you already have? Who do you already have supporting you? Thinking about what your child's medical needs are. What's in place? What's not in place? What therapies or medical treatments does my child need to address their condition or symptoms? What assistive technology devices or technologies would my child benefit from? Do my child need? What is the plan for managing my child's ongoing health needs? So, we're always thinking about what's next. What's the next transition? So thinking about in the future, what other supports might you need as your child get older, as your child transition to other environments, from elementary to middle to high school, transition into adulthood. And do I need support? Do I need help navigating my child's health needs and or insurance options? So we have several things. There's a community alternatives program, Medicaid, home and community services. We have Faith Action International, which really helps in terms of mental health support. Specifically for immigrants and refugees who are at least 14 years old and don't qualify for other benefits. We have the TEACH program around support for autism services. They do supports for families, but they also do trainings for teachers and support staff in school. A Kid Again, Central Carolinas, for families who have children with very intense medical needs. Carolina Children's Communicative Program grant. This particular resource can really help you in terms of around Medicaid, Medicaid managed care, medically fragile kids. If you need medical equipment and a challenge with getting those resources for your child. Health insurance premium, paying for employer-sponsored insurance premiums, medical grants to help with health-related services not covered by your health insurance or in any other way. And this is specifically for the Randleman area in North Carolina for children who have very serious and life-changing experiences and illnesses. Opportunity for a camp, because we are also looking at some social emotional support for our kids. And then here is ECAC with our contact to help with health information, Medicaid, innovation services programs, helping to navigate the health care affordability coverage system. It can be a challenge. And so the last one that we're looking at, and I know I just have 5 minutes left, I don't know what the time went, but thinking about these questions for advocacy and community support resources. What kinds of things do my family need in terms of emotional support? Do we need respite care? You know, I'm going to talk a little bit more about things to help support around self-care next week. How do I manage the stress of balancing caregiving, work, and daily life? How can we better understand and support the needs of siblings? And so these resources that I'm going to quickly share can help in a variety of ways in terms of emotional support, family support groups, strategies for balancing caregiving, work, and daily life, as well as supports around advocating for your child's needs. And we have a lot of these resources, so I am just going to quickly let you see what we have. Don't have time to really talk about them, but to know we have some of these programs that as we look at helping our children be involved in activities, sports. And as you are looking at trying to identify resources that could be helpful to you, I will just mention Family Support Network in terms of family support groups. And also, I know not at every site, but they do have some sites where they also do sibling support groups. So connect with your closest family support network. Support for foster families. But know that as you contact these organizations, asking about what services do they provide, how you access those services. You know, sometimes you may call an organization and you may get that organization, they may say, well, we don't do that. One of the things that we get a lot of is referrals from other organizations. So even if they don't do that, ask, do you know of another resource that provides services in this area? Because many times they will. Share with other families resources that you have found that are helpful. The goal today was to get you to thinking about resources, providing you with questions that can help you identify what resources that you need, and to make sure that you have a list of these resources and how to access those resources. And the last resources will be legal resources. One of the things that ECAC does not do, and many of the other resource organizations do not do, we do not give legal advice. So these are resources that are offered to families at no charge. Okay, Andrea, I think I got through this in in record time.
You did.
I am hoping that you all got some good information here, at least in terms of thinking about resources and knowing that we're going to send these materials out to you, if not today, tomorrow, so that you can take a look. And please do not hesitate to reach back out to us to ask questions. And please be sure to join us next week for self-care. Thank you. Andrea, I've turned it over to you.
Yes, and I just shared our evaluation. If everyone can just take 1 second to fill out that evaluation for us, that'd be great. The grants that we work on require that we report back to them what we're doing is useful, relevant, and of high quality. We appreciate your feedback, and I will leave that up until everyone gets a chance to fill that out for us. In the meantime, we'll say again, we will send these great resources out to everyone after. And if anyone has any questions, we're just at 12:30, but we can take any quick questions you may have. Beverly, I don't know if you see that comment for you with the email address.
Yes, I am taking that email down as we speak, and I will follow up. And if you don't have any questions, know to give us a call back. And thank you for helping us celebrate Family Engagement Month. And please take a look at those resources. And I hope you all have a great rest of the week.
Yes, and these are recorded. We are recording this one. For the most part, we do try to record all of them as long as we remember to do that. You can find them all on our YouTube channel under Tool Time Tuesday. And real fast, I can put that link up. Yep, if you're not able to join us, you can find those there usually a day or so after we record that.
And Janice, I will say in terms of someone coming to present information to parents, if you would reach out to ECAC, ask for Tony, and we'll see what we can do, because we certainly want this information out.
Yes. Have the link for YouTube. I'm going to share that real fast. There you go. And thank you, everyone. I think we, got everyone's questions. We appreciate your attendance today. And as Beverly said, don't forget to join us again next week, where we are going to be talking about the very important topic of self-care, which is really important, especially as we approach these holiday season. But thank you, everyone. We appreciate it, and have a great rest of your day.
Okay, thank you.
Thank you.